Hi, this is Dr. Farley. I want to go over with you what I call my expanded comprehensive health panel. I first learned about doing blood work, many years ago, starting in early 1990-91. And since then, I've done more and more and more. And then once our scope of practice changed, I believe somewhere near 2008-9, I've been running hundreds, thousands of blood work panels. And over time, I've built a panel that I call my expanded comprehensive health panel. What I see is when patients come in from going to see different doctors, general practitioners, endocrinologists, cardiologists, they get a very small number of tests because we're looking for something specific. So the cardiologist looks at the cholesterol to be able to say, hey, here's your cholesterol drug. The endocrinologist looks at your glucose to give you your diabetes medication. So everything is based on trying to find that panel to correlate it to give you the drug. My expanded comprehensive health panel has over 136 markers. It is by far 2 to 3 to 4 times more testing than you get from your typical doctor, period. We test for all type of anemia. We test for some genetic markers. We test for cardiovascular markers. We test for apolipoproteins. We test for inflammatory markers. We look at myocardial stress markers. We also look at diabetes markers, and with our diabetes or our blood sugar dysglycemia markers, we have about 7 or 8 that we look at. We look at connective tissue autoimmune markers. We must have 15, 18 of those. We look at our thyroid markers. In our thyroid markers, we run 1, 2, 3, 4, 5, 6, 7, 8, 9 tests. We also do a full CBC with differential and platelets, and then we run a group of other tests, a chem panel. We also look at other liver function tests. We look at micronutrients. We look at antioxidant levels. We look at amino acids. We look at electrolytes. We look at metabolites. We look at minerals, and we also look at intracellular products. So my expanded comprehensive health panel, I personally run it on myself twice a year, and from there I manage my health properly, looking at food and nutrients and what needs to change. So only when we measure function can we determine our level of health. If you're watching this video, this may be something that may need to be done on you so we can tell you what to do, and it will be part of your plan or part of your assessment. Thank you. Have a great day.